on Beyond Covid-19, the call for a European mental health strategy. Joining me today, I have Ms. Stefania de Mexant, who is a social worker by profession and who holds a master's in European Studies. She has extensive experience in the social and public sectors with over 20 years of engagement primarily in policy development roles. And for the past 5 years, she has occupied the post of CEO at Richmond Foundation, a leading NGO working in the field of community mental health provision, and is a member on the board of directors of the Mental Health Services. Next, we have Dr. Nigel Camilleri, who studied medicine and surgery at the University of Malta, where he was awarded an MD in 2003. In 2015, he started working as a child and adolescent psychiatrist at Mount Carmel Hospital, Malta, and St. James Hospital, Malta. He is currently working as a consultant psychiatrist and is the clinical lead for child and adolescent psychiatry at Mount Carmel Hospital. He is also the service lead for the first child and adolescent mental health MDT on the island in the private sector. Next we have Cyrus Engerer, who graduated in European Union Politics and Law. MEP Engerer became an MEP in 2020. During the first 6 months of his role as a Maltese MEP, Engerer became the co-chair of the Mental Health Coalition. Through the coalition, MEPs formulate amendments to legislative proposals, prepare parliamentary questions, band together to draft own initiative reports, and organize hearings and events related to mental health, together with the support of Mental Health Europe, the leading advocacy group for positive mental health and well-being and for the rights of people living with mental ill health. Up next is Honourable Mario Gallia, who has a BSc in nursing from the University of Malta and a postgraduate diploma in election observation and election monitoring from the University of Catalonia in Spain. He was a member of cabinet from 2008 to 2013, responsible for aging, mental health, pandemics, and infectious diseases, amongst others. Mr. Gallia also lectures at the Faculty of Health Sciences. As an opposition MEP, he is responsible for primary healthcare, mental health, diabetes, Alzheimer, and animal welfare. Mr. Gallia is the first Member of Parliament in Malta who speaks candidly about his mental health illness and is also a keen researcher on the subject. And last but not least, we have Her Excellency Mary-Louise Correiro Preca. Mary-Louise Correiro Preca was unanimously approved by Parliament as the 9th President of the Republic of Malta after being active in politics for over 40 years and serving in Parliament for 16 of them. She has dedicated her life to the well-being of the most vulnerable in society and contributed to bring about effective change in the social policies of Malta. Correiro Preca founded and chairs the Malta Foundation for the Well-being of Society, the Malta Trust Foundation, and the Emanuela Cancer Research Foundation, Malta. For the sake of the discussion, I will now be switching to Maltese so that most of the panel will feel comfortable. Should you feel that you would like to speak in English, go ahead. And all comments are welcome on this live stream on Facebook. So, l-ewwel mistoqsija. Fil-waqt li nafu li l-iżolament soċjali wassal għal problemi ta' saħħa mentali u rati ogħla ta' depressjoni u ansjetà, l-inċertezza kontinwa dwar meta l-affarijiet se jerġgħu jiġu lura għan-normal qed tikkontribwixxi wkoll għal ansjetà akbar għaż-żgħażagħ. Riċerka mir-Richmond Foundation li kienet mifruxa fuq 9 xhur uriet li waqt li fawissu nofs dawk ta' bejn is-16 u l-24 sena irrappurtaw li ħassew solitudni, 75% bħalissa qed iħossuhom waħedhom. Sentimenti ta' solitudni u iżolazzjoni fost iż-żgħażagħ kienu wkoll partikolarment għoljin fil-bidu tal-pandemija. Barra minn hekk, aktar minn 16% ta' dawk li għandhom bejn is-16 u l-24 sena ħasbu dwar is-suwiċidju mill-inqas darba f'ġimgħa f'Diċembru. Il-fuq minn inqas minn 4% f'Ġunju. Innotajtu bżieda fi problemi ta' saħħa mentali fost iż-żgħażagħ u taħsbu li l-maġġoranza taż-żgħażagħ li esperjenzaw dawn il-problemi marru jfittxu l-għajnuna. Qabel ma nibdew id-diskussjoni nixtieq nagħti il-flor lill-Onorevoli Gallia sabiex jagħmel intervent żgħir.
Okay, sorry, niskuża ruħi l-ewwel li dom nara biex nidħol minix il-guru tat-teknoloġija. Se nagħmel se nirrispondi jekk mhux ma jimpurtax bl-Ingliż because I thought it was in English. Okay, first of all, whilst we know that social isolation and loneliness is linked with poorer mental health and higher rates of depression and anxiety, the ongoing uncertainty around the world when things will let naqra l-mistoqsija, skużani. I would like to congratulate the KSU from bringing this very important item on their agenda, process tassew, and give us all the opportunity to discuss the other silent pandemic because we are, apart from the COVID-19, in another silent pandemic that the world is enduring, the pandemic of mental illness. The World Health Organization has long been forewarning the world many years before the COVID-19 pandemic hit the globe that we'll be facing an unprecedented, devastating mental health pandemic. This mental health pandemic is now with us. It is now even much worse with dire consequences because of the COVID-19, depression, anxiety, stress, and mental health illness, and regretfully suicide are on the increase worldwide. In fact, I would like to tackle briefly suicide in a few moments. First of all, allow me to make a personal note. As you've said, I am a qualified nurse, I am a lecturer at university, member of parliament, spokesperson for mental health. But please look at me as a person who suffered from mental illness. I suffer from depression and anxiety disorder, and I am on treatment. The only reason why I speak publicly about mental illness is because it is scientifically proved that whenever public persons who suffer from mental health problems speak publicly and openly about their mental disorders, this will help to reduce stigma and encourage others to seek professional medical help. Il-fatt milux kellna 4 MPs fil-House of Commons li ammettew pubblikament li għandhom problemi ta' saħħa mentali u l-NGOs li jaħdmu f'dal qasam l-Ingilterra qalu li kien jum storiku. Jiena nittama illi naslu fi stat li meta MP u persuna pubblika tajt li għandha problema ta' saħħa mentali ma jibqax jum storiku. This and only this is what prompted me to speak publicly about my mental health problems. It is estimated by the World Health Organization that when it comes to people suffering from depression, about only 30% seek and get adequate professional treatment. And the tragedy is that untreated depression remains the main cause of suicide. It is the feedback I get from people from all walks of life after speaking of my mental illness who confide in me confidentially about their mental health ailments. Many times they endure in silence, which encourages me to continue to speak publicly about my mental health condition. On a regular basis, I have calls from people who I do not even know, and some of them I never met, phoning me to speak about their mental health problems, and I always encourage them to seek professional help. I would like to mention 2 experiences briefly. Darba kelli student li stajt il-lectures talab li jiġi kellimni wara u dana li impressjonana għalli jisma jiena nħossni komdu nitkellem miegħek għax inti titkellem pubblikament għalli jiena imbati bid-depression qed imur għand psikjatra hija on treatment u laqqas mill-ommi u l-missieri mat għax nibża mill-istigma laqqas ommu u missieru ma kien jafu mbagħad ovvjament bil-permess tiegħu referejtu l-università u tawh l-appoġġ. Darba oħra kont health center, kelli bżonn nebulizer, mhux se nsemmi l-post fejn, u tabiba li radna qalt li jiena obbligat ħafna lejk għad laqqas biss nafek. Qalt li jiena għamilt snin twal u għadni mbagħad bid-depression qatt ma tkellimt. Għalt li meta darba smajt lilek titkellem pubblikament, għalt li ddeċidejt li mmur psikjatra nfittex l-għajnuna għal daw confide ma' sħabi li jaħdmu f'dal-post tax-xogħol. Għalt li llum when I have a bad day niġi hawn xorta x-xogħol fl-oħra sikli, nipprova meta għal ftit mument toqgħod ma' l-istaff u nitkellem man-ners jew ma' xi ħadd mit-tobba li jaf għax dawn huma grupp żgħir. U għalt li, ġifiri li jett niprofa ngħid mhux biex nelabba tal-hero, I'm not a hero. Sempliċement kemm importanti li nitkellmu fuq dan is-suġġett. At night, I never politicized the subject, even in my role as a member, as a parliamentarian. So any suggestion or constructive criticism from my part, please take them as my humble contribution from someone who not only researched a lot about the subject, but most importantly, I experienced mental health illness myself. I have no qualms to admit that for me, every day is a struggle to wake up in the morning and face the world. Literalment, ma jkollok xabtitkom is-sodda. Um, but thank God I have now managed to embrace my mental illness and learned the coping strategies which are the most effective for me. Kindly allow me to address suicide briefly. For many years, there was a belief that if you speak openly about suicide, it will encourage others to commit suicide. For so many years, we were completely silent on this subject. Suicide is still engulfed in a taboo, yet scientific research published lately shows that we have to start speaking openly but responsibly about suicide. Our silence on suicide over the past years, and regretfully our reluctance to give the right information about suicide, continue to fuel myths about suicide. According to USA Center for Disease Control and Prevention, in 2008, suicide was the second cause of death in the United States of America amongst people aged 10 to 34, and fourth cause of death amongst people aged 35 to 54 years. First of all, according to WHO, suicide has become a global tragedy. It is estimated that every 20 seconds, a person commits suicide worldwide. For every for every successful suicide, at least another 20 people attempt suicide, thankfully unsuccessfully. So we've got one suicide every 20 seconds and another 20, at least 20 people who attempt suicide, but they will remain alive, thankfully. From those who commit suicide, the majority are men, and if you are suicidal and under the influence of substances, including alcohol, that will increase the risk. Allow me some time to address very briefly some myths about suicide. People who talk about suicide are bluffing. They will not do it. I would say, as my colleagues know, be careful. Many who commit or attempt suicide give some kind of discreet clue beforehand or warning, even jokingly. Like things you'll be worried, sorry when I'm gone, I cannot see any way out of my problems, only that can solve my problem. Browsing the internet to find sites on suicide, talking repeatedly about death. I will mention two experiences which I know, which I personally know. There was an elderly person which I knew very well, and had an old gun because he used to live alone. They used to go to a field with his relatives, and he told one of his relatives if he could grease the gun because he would like it as a protection in a working condition, as a protection because he sleeps alone. Then they were training on empty cans, shooting this gun, and he used to joke in a funny way. He used to say, "Sometimes I will stick this gun to my head and I will blow my head." And obviously they used to laugh. They too used to take him with a pinch of salt, so it was sort of a joke. I don't blame them. They have a lot of guilt feelings now, but ultimately they found him dead with a self-inflicted gunshot wound in his head. So sometimes even jokingly, I know another case, and another case. Someone went to a bar in Zaytoun, and he said with a piece of rope, and they said, "I'm going to my remissa where the horse is, and I'm going to hang myself with this rope." Everybody was smiling, laughing because he was joking. They thought he was joking at least. And 4 hours afterwards, they found him dead. He managed to hang himself with the same rope. I do not blame the people who did not take action because I think it's our fault, the healthcare professionals, because we don't give much and adequate information about suicide. All people who commit suicide, it's another myth, have mental health problems. False. Many have mental health problems, but there are others who fall victim of a problem which for them seem as unsurmountable. Example, financial problem, divorce, legal issue, chronic pain, news of terminal illness, etc., etc. Remember that many who attempt suicide um, rather than wanting to die. They want to end their suffering and end the pain of their problem. Pain, be it physical or psychologically, becomes unbearable for them, and they see suicide as the only way out to end their suffering. In fact, it is estimated that 1 in 5 people have thought about suicide in their life. And I'm going to admit for the first time that last summer, in August, I walked 8 kilometers a day. I was in Gozo by myself, and I was passing through a very rough time, and I was looking for a place from where to jump. And I wanted to be sure that I killed myself. Then I spoke to a friend of mine, and this was only last August. I spoke to a friend of mine who took a clue. I did not actually tell him, but he took a clue. He phoned my psychiatrist. My psychiatrist phoned me and he said, it's either you leave immediately from Gozo and come to my home, or else I'm going to Gozo to fetch you myself. I immediately took the ferry back and went back. And I regret that I was going to commit suicide, but this happened only last August. And I'm saying this not for compassion or sympathy, but to admit how fragile we are all at the end of the day. If someone wants to commit suicide, another myth, nobody is going to stop him. False. Often feeling actively suicidal is temporary, even if someone has been feeling low, anxious, and struggling to cope for a long period of time. Even the most desperate people will continue to have doubts till the last minute if they should end their life. In many instances, there is subconsciously a discreet last cry for help from the victim. This is why getting the right kind of support at the right time is so important. Another myth, people who commit suicide are those who never sought professional help, which is false because study shows that at least 50% for those who actively and successfully commit suicide, 50% of them have seen a psychiatrist or a psychologist in the preceding 6 months. There are many other myths I could tackle, but I will not. I will stop here. I just wanted to touch the subject. My departing note is that each one of us can prevent suicide. Be on the lookout for clues, and if you suspect suicidal intent in anyone of your close circle, be it a relative or friend, find a quiet place and ask him discreetly if he's thinking about suicide. Talk with him, stay with him or her, encourage to accompany that person to a psychiatrist or psychologist immediately. Suicide can be a taboo topic. Very often, people who are suffering, who are feeling suicidal, don't want to burden others how they are feeling, and so they refrain from discussing their suicidal thoughts or intents. By asking someone directly about suicide, you give them permission to tell you how they are feeling. People who felt suicidal will often say they felt a huge sigh of relief when they opened up with someone about what they were experiencing. Once someone starts talking, they've got a better chance of survival because they tend to discover other options rather than suicide. I would quote Rory O'Connor, who is a professor of health psychology at Glasgow University, and I will end with his quote, who said, Rory O'Connor, professor of health psychology at Glasgow University. Quote, evidence shows that by asking someone if they are suicidal can actually protect them. They feel listened to and hopefully less trapped. Their feelings are violated and they know that somebody cares about them. Reaching out to suicidal people can save a life. Thank you very much.
Grazzi onorevoli, grazzi.
Għajdli Mario ħallik minn onorevoli. Onorevoli hija sfur tal-passaw tinsiex li f'Malta u ħafna kaċċaturi.
Grazie. Thank you for being so candid. In line with what Mario mentioned, um, my question is, um, have you noticed an increase in mental health issues amongst youth on a first-hand basis? And do you think that the majority of youths who experienced these issues resorted to seeking help? Ħanajdu Malti wkoll, just in case. Innotajtu bżieda fi problemi ta' saħħa mentali fost iż-żgħażagħ u taħsbu li l-maġġoranza taż-żgħażagħ li esperjenzaw dawn il-problemi marru jfittxu lajnuna? Il-flora miftuħ fidejkom.
Ma nafx nistax nitkellem jiena jew forsi nista' ngħid bħala child psychiatrist. Grazzi lil Mario Guy, it is a very interesting personal account, which is very true. Kif qal Mario Guy, I mean, we see there are a number of people who are suffering, and every 40 seconds there is someone who dies of suicide in the world, and that is equates to 800,000 people in the world a year. It is no joke, which makes it a public health priority. I think it is time for a mental health campaign to raise awareness on mental disorders. I think that we start from a very general. I think starting off from a very general appeal. I think there have been a number of changes, and there has been a lot of push and awareness being raised recently. Jana, within our services, there has been a push to Gloucester within COVID. There has been a lot of talk on how to improve our mental health services and how to provide a better how to provide better quality service and how to reach out to more people. However, although COVID came, we weren't ready for it, and the numbers have dramatically increased. If you talk about young people, I don't fully have facts here of the numbers coming in, but we are inundated. If we came in the national service and also in the private sector, it is becoming so numbers are on the increase. The main concern is probably most commonly is anxiety, okay, and a lot of anxieties within young people. Apart from that, we have anxieties of also anxiety about COVID, but there is a lot of anxiety now about going back to what is normal or even leaving the house. So young people are more comfortable now on their laptops, and that has become a big problem. But moving towards, and what we've been seeing in the last months, what was the recent measures being introduced, because people were hopeful with the vaccine, and once again, we are now there's reduced contact, especially 16 to 24-year-olds. We have seen, which is worrying, an increase in relapse of severe mental illness. So we are getting quite a few people admitted to Mount Carmel Hospital because of sudden onset, either first onset or maybe a relapse of bipolar disorder, psychosis, schizophrenia, and then very severe challenging behavior. I think our services are being challenged at many levels. The capacity, the staffing capacity and training is what it is. There has been a big push to improve this, but I think the pace needs to be stepped up. It needs to be given a focus. I know there is talk about for a new hospital, but I think as an organization, we need to quickly become more structured, and we need to get together. There are a number of services, and I'm seeing a number of people here representing different services. We've worked together, possibly coming together, not doubling up on services, and seeing how we can address this mental health crisis. I think we have to call it what it is. I'm not going to take over the whole thing. I'll stop here, but include me or... That's it from my end.
From our end, our services are not so often frequented by young people, with the exception of maybe the helpline. But we have seen a lot of parents calling and asking for information and guidance with regard to their young people's mental health, and even, as Nigel said, younger. So we're talking of parents of 11, 12, 13-year-olds who have been impacted by the changes in schooling, the isolation. Obviously, at that age, the children are already struggling with puberty, sense of self, and they're already going through a lot. And now the pandemic has loaded them with this lack of socialization. So the fact that so much has changed has impacted the young people. We have been informed, interesting, that a lot of young people have been in touch with, for example, Aġenzija Żgħażagħ. So wanting to discuss their mental health in what I might call a bit of a more streamlined manner. So they didn't opt to come to a mental health organization, but they opted to start off within a setting which they are already familiar with and which is not labeled as a mental health service. And I think from that perspective, we really need to draw some lessons, because young people will look for services where they feel comfortable. And I think this needs to be taken into consideration as we are planning more services and changes with regards to what should be available for young people.
Neil, I don't know, can I take a turn on this? Okay. First of all, I'd like to thank KSU for bringing us together and organizing this webinar. I think KSU is one of the foremost students organizations that are very aware of mental health. In fact, the Malta Trust Foundation has been collaborating with KSU for the last, I think, 3 years now, including Richmond, to provide for mental health first aid courses, in fact. So I really would like to commend KSU for continuing with this raising of awareness, but also providing the space for even university students to learn more, and also a sort of self-help initiative. Well, I am not medical at all. However, I've been very near to mental health issues for a very long time. While I was in Parliament, I used to shadow mental health, etc. And well, from my contact with people, for as long as I can remember, these issues have always been there, and decades pass, and always we speak of stigma and raising awareness, etc., etc. So I think it is now even more about time to come together, as Dr. Camilleri has said, and try to together do really something effective and impactful about things. I'm sure Mario, I'm seeing Mario nodding. Mario has been the I would say a bulwark of this, for speaking so loudly and so insightful in Parliament. But I think we should really consider, even and now when we have also a national strategy from 2020 to 2030, to really come together in the most effective of ways to ensure that we leave the necessary impact. Even more so now, after what we have experienced and are experienced during COVID and post-COVID, which all research is showing us locally and internationally that it's not just during the COVID period where issues of mental health have arisen or rather increased, but even post-COVID, we will need to tackle those issues very seriously, because there would be, yes, a compounding of certain aspects of this. So my contribution, I will center my contribution, or rather focus my contribution, in the sense that mental health and many common mental disorders are shaped by various social, economic, and physical environments operating at different stages of life. There are a lot of risk factors for many common mental disorders, which are heavily associated with social inequalities, whereby the greater the inequality, the higher the risk of mental ill health. And I had personal experience together with my colleagues from the Malta Foundation for the Wellbeing of Society, where during the first lockdown, our usual engagement with children are, or rather, and also the first encounter we had with children in the first weeks of the first lockdown last year, we were surprised how children were being affected. Affected not just due to loneliness, but also due to a certain number of factors. I will just mention a few statements we heard during this very first space where children and young people were encouraged to speak. For example, a boy of about 12 years old was telling us, we are now stocking loads and loads of noodles. We will eat loads of noodles as my dad's business is closed. So this boy coming from a very affluent family was speaking of noodles and speaking of eating lots of noodles and continuing and speaking of sort of the situation at home. Another young person told us, I'm feeling extra. Adults around me are all the time telling me to go to my room and be quiet. And he literally said, thank you for these meetings. At least here, I know you care. So one has to really think and analyze these statements. ċaħtiħor għal jien nħossni mdejja għax l-iskola magħluqa nixtieq nistgħu niltaqgħu lin kollu tal-council għax dan huma grupp tal-Children's u Young Persons Council. And another one said, I have recorded lessons and look forward to hearing the teacher's voice. ċaħtiħor għal if I could change anything, I would like to see all my teachers because I miss them a lot. ċaħtiħor għal jien f'din is-sitwazzjoni inħossni mdejja ħafna għax nimmissja l-ħbieb u l-għallima kollha tiegħi. So these are children and young people. I've selected a few of these statements, and this was just in the first week or a couple of weeks from the first lockdown. So the impact was already being felt and from a variety of situations. Kenna per eżempju wkoll laqa ma' diversi kunsilli tal-studenti tal-Malta Trust Foundation propju naħseb ma nafx hekk kienx hemm imma naħseb li jeżmin kienet preżenti biex niddiskutu sensiela oħra ta' korsijiet fuq mental health first aid, niftakar is-sena li għaddiet kienet online ukoll u kulħadd kien qed jirrakkonta ċertu ċirkustanzi li to be honest, meta tismagħhom tibda tirrealizza l-impatt kemm kien kbir. Per eżempju ta' studenti li ma kienu qed jidhru mkien fuq l-iskrin u meta ġew mitluba biex jgħidu sort of you need to be seen on screen, kien hemm min stqar li jistħi jixel il-kamera minħabba l-fatt li jgħix substandard housing. Oħrajn ma qatt ma xelu mhux biss ma xelux il-kamera waqas il-laptop għaliex m'għandhom spazji fid-dar. Ġifieri l-kwistjonijiet tal-inugwaljanzi ukoll ħallu impatti psikoloġiċi ma f'dan is-sens ukoll impatt anke fuq il-proċess edukattiv tagħhom. Xina qed ngħidhom daw biex pereżempju mbagħad when the Malta Trust Foundation ran the food aid project to help people, individuals and families cope with those vulnerable people that lack financial resources to buy even the most basic of foods during the first lockdown. Amongst these were young people whose employment had ended abruptly, families with adolescents and young people, and single parents with young people. And the vast majority indicated that their mental health and well-being had deteriorated somewhat, but they could not reach out to any services. And this is something now that links also with services. So I think also this we need to think about, to reflect on, and also act. And in this sense, I would like to mention Gozo. When we speak of mental health in Malta, please identify Gozo. We need to give visibility to Gozo, because if people in Malta, on this island, on the big island, felt that they could not reach out to services, Gozo, it's worst off. And well, I can tell because, again, the Malta Trust Foundation had 3 years ago started with a community-based mental health service for young people. And we again partnered with Richmond to give out the service. And you know that Gozo has a lot of gaps in the issue of services. There's no halfway house. There are loads of things which are services that are completely missing. So when we also speak of mental health services in this country, we need also to identify Gozo on its own, because if we make it invisible, we would not reach out to the people that live on the island of Gozo, due to the fact that there are huge gaps in the services there in terms of community services and other services. I can go on, but I prefer to leave space to my colleagues. Obviously, I will come in when Neil invites me.
Thank you. Cyrus, would you like to pass
Yes.
a few comments before I move on to the next question?
Yeah, sure. First of all, thank you for organizing this interesting conference today. It's a pleasure being here. Obviously, I'm going to answer this first question mainly, and I link it to some other thoughts that I have with regards to this subject. First of all, yes, unfortunately, during these past months, I have been in contact with a number of people who have said that they are going or undergoing a number of mental health issues because of the COVID situation in their country or in their homes. Obviously, mental health is not solely linked to a specific demographic in society. It is a reality for all, whether they're young people, children, older people, the elderly, males, females, those who do not identify with any gender. It is something that affects each and every one of us. So when I hear people like Mario, who today spoke very openly, as he has been doing for the past years, I would contradict him a bit in saying that, yes, he is a hero, because listening to people like him does help many other people who are undergoing the same situation. And it is best to feel that you are not alone. It is one of the best things that could happen to you when you are undergoing certain circumstances, to feel that you're not alone and that there are other people who are going through the same situations that you are, and that could give someone something to relate to. So I think what Mario is doing is heroic and helps a lot of people, not only those who maybe listen to him directly, but also those who listen indirectly to what he would be saying. One thing that I have found in my work during the past month, I known people with mental health issues. I myself have gone through situations or periods of time where my mental health was not at its best. I do not think, or I don't know whether I have been through clinical depression, let's say, or something that has been diagnosed by someone who is an expert in the field. But I, like many others, have gone through patches in my life which might have were obviously not that comfortable mentally, let's say. My experience now as a member of the European Parliament, I am a part of the public health committee in the European Parliament. And one of the first things that I noticed was that, unfortunately, there wasn't much talk in the past on mental health issues. And in this run-up of the European Union, to have a European Health Union in the future that has been triggered by the pandemic, I was one of those who spoke about the fact that this European Health Union should also include mental health, because so far the European Union has not got a mental health strategy, which I believe that it needs, and should be an integral part of this European Health Union. Speaking on this, I was approached by a number of members of the European Parliament who basically agreed with me and thought that we should do something together. So we started this alliance within the European Parliament on mental health. And the interesting thing is that once you start speaking on the topic, a number of people start reaching out to you to give you their experiences of what they're going through, which is obviously interesting and gives you more information to be able to work even more politically when it comes to this subject. But one thing I have realized is, and this is where I go back to Mario and then saying that yes, he is a hero as well, because in my experience so far, I have hardly ever had any contact with men who speak about their mental health experiences. It seems that it is much easier for women to speak of their mental health, whilst men take a step backwards when discussing this issue. And apart from that, this is also the case when it comes to the alliance that we have in the European Parliament. We are 5 co-chairs in the European Parliament. 4 are female, and I am the only male who is working on this topic. It seems that somehow while it is still a taboo in general, it is much more of a taboo when it comes to the male gender in our society. So I have been trying to raise more awareness on this from this particular point of view. One thing that I have also seen, and it's obviously at this moment in time with COVID-19, many people are feeling pressured, they're feeling stressed with the situation, stressed with the fact that they cannot live their lives as they have been accustomed to do for a very long time. Stress now also because we have become accustomed to this new normal, which we're living in today. But I have seen I've been contacted by a number of people, of young people as well, who form part of the LGBTIQ community, are at this moment in time who are having some problems, especially at a younger age, when they wouldn't have come out to their parents or their guardians or whoever they live with, and are currently confined to living all the time with those people who have no idea about the sexual orientation of their children or whoever they're living with. This problem goes back to the past. I remember a time in our country, and I'm speaking of when I was much younger, I was in my teenage years, when I used to attend a number of funerals of people who are my age, who I knew through the LGBTI community, who were friends of mine, who, however, never could come out to their parents, or who were not accepted at home after coming out. And I remember there was a particular period of time where one by one, a number of my friends started committing suicide. And I used to attend a number of funerals of a number, never felt accepted. And somehow, over the years, with the change in mentality in Malta, with the number of legislation that came in, I saw a change where I didn't find many people who are undergoing this kind of stress any longer. It sort of decreased. However, I have seen an increase of this once again during the pandemic. It might be related to the fact that these people might be spending more time at home with lockdowns in a number of countries and a partial lockdown in our own country. And they might feel that they are not totally accepted, and spending more time with their parents who have not accepted who their children are led to a number of mental health problems, stress and anxiety once again. So for now, I'll conclude with this. But a short answer in a nutshell to your question is yes, I have met a number of young people currently during the pandemic who have had increased levels of anxiety and mental health issues.
Thank you.
Neil, can I come in there on the point that Cyrus mentioned? I think it's extremely important. Iġifiri, he mentioned with regards to the difficulties young people are having with coming out. We've just completed with a group of researchers, we just completed research on how difficult it is for parents to accept this. I think it is extremely important. I mean, if parents are listening, no matter how difficult it is, but I think it's extremely important to try to understand the young person, because it does lead to a lot of anxiety, depression, anger, self-harm behaviors, because parents cannot accept the fact of the gender identity or the sexual orientation of their children. I know it may be slightly different to COVID, but I think it's extremely important. And I think with a number of things. So if parents react in a shocked way, you're depressed, Hazin, it's not a choice to be depressed. You're homosexual, Hazin, it's not a choice. But I think if we're one key thing to the parents, if we can, I know it's not easy, probably bringing up teenagers. We were all teenagers. We were probably all relatively difficult. Well, I was. But the truth is that the more we accept our teenagers, the young adults, the more we can work with them and the more we can enable their mental health. It's the one point on COVID, just to quote the mental health crisis that we have, to quote Sir Michael Rutter, who is the father of child psychiatry and psychology. I mean, he stated that in the 21st century, although the indices of social wealth and physical health are improving, amongst children worldwide, mental health, the indices in young people are deteriorating. And this is not just Malta, but I think it is extremely important that physical health and society are getting richer, but mental health is going down. And I think until we accept that, radically accept it, and then affect change, things are not going to move forward. I think that is where we're at. And it's great to hear that there's a mental health strategy in Malta at the moment, and that at the European Parliament it's being discussed. We need action, though.
And I add something to what Dr. Camiller has just said. Unfortunately, we've known of all this for decades, and I'm one of those who have become very impatient, speaking ad nausea on things repeatedly for decades and decades and decades. Pre-COVID in the European Union alone, in the European member states, 18 million children and young people, from 10 years to 19 years, 18 million suffered from depression. This is pre-COVID. I wouldn't know at this point in time the increase, but this is huge. This is enormous, and we know through loads of research internationally, regionally, but also in our country. Richmond Foundation, Chefai et al., university students have also had this survey recently. The Kunsil Nazzjonali Żgħażagħ, Dr. Mari Briguglio and a number of her colleagues, economists, have also researched during the first lockdown on life satisfaction, and more and more. I'm just mentioning the few recent ones. So we know all this, and we need action, as Dr. Camiller is saying. We have a strategy, we need to be united on this. We cannot continue with everybody doing his or her bits, but we need to come together, and we need to come together in a holistic approach and ensure that the implementation of this national strategy. We've been talking of suicide. We have also to mention that we know from research that suicide is affecting more men than women. In fact, in October 2018, the Malta Foundation for the Wellbeing of Society, we issued a video on suicide entitled Tkun Raġel. Purposely, it was from an evidence-based approach, obviously, together with stakeholders, clinical stakeholders, practitioners, and academics, purposely because the issue of suicide affects more men than women. So there is a gender gap there. So we have so much, that we know. And on the other hand, we still are not reaching the aim. There is an educational divide too in this field. The parents, I'm really pleased that parents have been brought in the equation now as well with regards to young people and children, because yes, I mean, unless we address also this educational divide with regards to parents, will still continue have the wrong reactions and to the children, to the young people that feel that they need to open up, but they are practically snubbed, not out of lack of compassion, but lack of awareness, lack of education. So there is no other way except uniting to make sure that that strategy is implemented well, that we not just, it's very easy to say implementation, but because we also need the professionals there. We need psychosocial professionals for in this field. And well, there is a lack of them in this country. Not just a lack of them, but also, for example, let's take in our schools, in our schools, in our education institutions, we need more psychosocial professionals to be there. We need to have more psychosocial teams in our school colleges and in our education institutions. But also we need to how would I say this? We need to acknowledge their worth, even in terms of compensation. You cannot have a social worker studying for about 4 years at university and then ending up in a public sector employment and being compensated with a salary that goes to for clerical duties, let's say, or a psychologist that ends up, taking a scale 10 salary at home after about 9 years to actually graduate with a doctorate. This is ridiculous. So many, even if we have enough psychosocial professionals in this country, we are not encouraging them to get into state services where we need most, because we must ensure that mental health services are truly and effectively accessible to all, because the vulnerable groups are even more impacted because we know that there are this social determinant of mental health, and which affect vulnerable groups, disadvantaged groups, who many a time are also constrained financially. And therefore, we need to ensure that mental health services are truly free of cost, so that they are effectively accessible to these communities. But we can unite, we can bring in all our strengths together, that is all stakeholders, including civil society organizations such as Richmond, and there are quite a few more that can be brought in, because we need also civil society organizations to be there. They are doing wonderful work. They need more capacity, and then they can do even more. Obviously, they need also funding, so they need also resources. But together, I do believe that we can do quite a lot, together with the proper compensation for psychosocial professionals that would be encouraged to go into the public sector, so that we can ensure that each and every person on these islands can have the services that they deserve, dignified and effective services.
Thank you. One moment, Mario. I think you need to press unmute first. Okay.
Could I come in for?
Yes, of course.
Yes. I read a local study on the effects of the last year, more than a year now. And there was an increase in substance abuse among youths, alcohol, cannabis, increases smoking, increase in anxiety, stress, and loneliness. But I would also like to advocate because according to the WHO, World Health Organization, screening 14 years old, perhaps Dr. Nigel Camilleri could come in on this. Screening 14 years old will diagnose 50% of youths with early symptoms of mental illness. And then if you screen again those who are 24 years old, you will diagnose 75% of those with early symptoms of mental health illness. So we need to put the screening in place, because imagine if we catch these people so early in medicine. There is one crucial phrase which we always repeat, we always say, but which we need to start practicing, that early intervention is the best intervention. So if we manage to at least identify 50% of 15-year-old and now 24-year-old by screening, 75%, I think it will make a hell of a difference. One other thing on loneliness, I found a very interesting study about loneliness, because most people are feeling lonely, especially youth, as Her Excellency said, elderly people. I know she is in touch with these people and she is passionate about it. I know her in Parliament. She is passionate about the social well-being. I think this was mentioned by Cyrus as well. Loneliness, scientific, is proven to shorten a person's life by at least 15 years. And it is equivalent in terms of health to the same impact to those who are obese or smoking 15 cigarettes a day. So being lonely or being obese or smoking 15 cigarettes a day, it will shorten your life to 15 years life expectancy, apart from the fact that we know that loneliness is one of the reasons for people to commit suicide. I know, I appreciated as well what Dr. Marie-Louise Colero said about compensation for psychologists and for social workers, which is totally peanuts, and probably psychiatrists too. Nigel is here and can confirm. Most psychiatrists, thank God they have private practice, because they wouldn't live comfortably with the pay they get in the public sector. And I'm not criticizing by any way this government. This was the same problem under my government as well. So please don't take me, I'm not being partisan in any way. What I would suggest, perhaps it's a stupid suggestion, but I was thinking when I was preparing for this, I think university, as Her Excellency said, university, MCAS, junior college, and other educational institutions need to increase their capacity and access to counseling with healthcare professionals like psychologists, counselors, psychiatrists, even if at the time this has to be done online. This service can be extended in community level, and I would urge initiatives by the parishes, by community organizations like the Scouts, for instance, local councils. But I would like, at this moment, because we don't have enough, and we don't have probably the financial resources to pay these people. I think you've did it after the incident of Your Excellency. You did it after the incident of I don't know what they call it, the incident at the airport now, or whatever it is. Yes, I think we need to tap on the voluntary contribution. I am sure we will find psychologists and counselors and psychiatrists and even psychiatric nurses who are ready to offer a few hours free of charge to help those in need. We are going through a national emergency and unprecedented times, and I am quite confident that voluntary contributions from competent professionals will be forthcoming. One final departing note. I was reading another important research about the effects of COVID on frontliners. Experts are saying that after COVID is over, our doctors and nurses who are on the front line, they're going to suffer from post-traumatic stress disorder, which is practically the same for soldiers who are returning from war. So I think we need to prepare for these frontliners. We supported them, we applaud them for what they are doing, but very soon they will be needing us to support them because they will go through a difficult patch, at least. That's what experts are saying. So we need to be prepared for this as well. Thank you.
Go ahead.
Neil, would you like to continue with the questions, or shall we go ahead with the discussion?
Go ahead.
A number of very interesting points have been made, but I would like to take a bit of a different perspective. We're talking about COVID, but we are also very much aware that whereas the physical aspect of COVID will pass, the mental health impact will stay with us. If we pick one example, if the adults have been affected and will be affected for the long term, their children will suffer the repercussions. Because if adults at home are stressed, the children will obviously be impacted. So I would like us to also look at prevention. We have a tendency, and not just in Malta, to look at mental health as predominantly a health issue. There is a problem, we look out to identify it, diagnose, medicate or treat, and hopefully resolve. In actual fact, as Her Excellency mentioned, there is so much more. Poverty, a whole range, substandard housing, but I would like to focus a bit on education. If we were to inform our educators and equip them with basic information about personal development, we're not talking about mental illness here, we're talking about personal development. How can we help even the youngest of our children from childcare, from kindergarten, how to develop certain resilience? How can they be better prepared to look at difficult situations, try to reframe their idea of a difficult situation rather than react in an anxious way, try and take one step back and look at maybe the opportunities which come from adversity. So I think one of the very important things which this country needs to do is start to look at mental well-being from a much wider perspective to prevent and to strengthen individuals to be able to face all the colorful things which life presents us with.
Thank you, Dr. Demexant. I will move on to our next
Can
question.
I come in to answer Mario's?
Of course. Keep it brief because time is pressing, if possible, please.
Yes. Regarding young people, 1 in 10 suffer from a mental disorder. 75% of mental disorders start before the age of 25. So we need to invest in young people. Services, unfortunately, we're currently working on a push here. I think it is the environment, but we still need a proper place for young people services within the government. We're still at St. Luke's. We need the development of a child secure unit within social services because we're having a big problem with children with challenging behaviors. We need the onset of an adolescent forensic unit, a proper one for young adults and adolescents with aggressive behavior because they're ending up either at Mount Carmel Hospital locked away or in prison or on the streets. So that to answer, we are also carrying out a research. So we're currently doing the screening exercise which Mario mentioned. So there is a national screening exercise going on for the incidence for the prevalent study of mental health in Malta, and that's being carried out. So I think there are 3 things to focus on. 1, we need the building, we need environment, we need staffing, there's some increase, but we need staffing and we need training. Those are the 3 points.
Thank you. My next question is related to what Dr. Camilleri just mentioned, specifically about the services offered. Reports have recently emerged regarding Mount Carmel's state of neglect, and just 2 weeks ago, Malta's Nurses Union, the MUMN, has expressed its disappointment and its disapproval at the fact that 8 wards at Mount Carmel Hospital have closed down, some of which were closed down more than 6 years ago, as a result of the continued deterioration of the hospital, whilst describing promises of government investment as fake news and non-existent. They also said that the present situation went contrary to all established psychiatric guidelines. Therefore, how can we help fight mental health stigma when the nation's mental health hospital portrays exactly that same stigma, and is the government treating mental health as a priority? The floor is open. Would Dr. Demek-Sant like to start?
Neil, yes, a very pertinent observation. Actually, mental health has been stigmatized for many years, and Mount Carmel and the situation which Mount Carmel is in is partly a result of that stigma. Ironically, it also helps to further perpetuate the stigma, because obviously people are not, nobody likes to go to hospital to start with, but there's a difference in going to a hospital like Mater Dei or going to a hospital which leaves much to be desired. So yes, there is a problem with that. Over the COVID period, there has been some closing down of wards, which fits into the national mental health strategy, because in actual fact, a number of people who were within Mount Carmel didn't need to be hospitalized in a psychiatric hospital. They didn't have the acute need. So they were just residents there. They might need assisted living, which is being provided. Some of them were elderly and are now being accommodated in the community. So this shift does fit into the mental health strategy. What we need to be careful about is what services are available in the community for people to be adequately supported. So it's not just about reducing the capacity of a hospital, because people will still need services. So we need preventive services. Nigel referred to early intervention with young people, for example, to catch them in time, to support them and their families, to prevent, as far as possible, their mental health conditions from deteriorating, and hopefully prevent them from needing hospitalization. But they will still need services in the community. So key here are the strengthening of the existing services within the community and the widening, setting up even more services, because people will need a whole variety of services in the community. And unless we take like early, immediate, I was going to say, action with the right resources, it's true. Human resources, I mean, you cannot develop human resources overnight, but you can redirect some of the resources which were previously providing a service, for example, within Mount Carmel, retrain if necessary, to engage them in the community. We definitely need significant increase in funding for the mental health services, not for Mount Carmel, but for the wider services to be able to support people in the community adequately.
Neil, I would like to stress some points which I agree completely with Stefania. We do hope that mental health hospital, a new one, would actually be built, because yes, we will have some needs for acute situations, undoubtedly. However, I too believe in community mental health services. I believe in them. Many people end up in Mount Carmel, unfortunately, without the need of being there, but due to the lack of appropriate community health services. I have had experiences of people, even when I was very close to the constituency that I used to stand for elections, where they ended up there, unfortunately, when they could have been taken care of on a community level. With regards to children, unfortunately, YPU has ended up being the place where even for practically the slightest thing, you and children are sent there. I remember times, I don't know what the situation is here, if children out of home care could not be kept in the home where they were living and were passing on from one home to another. If there are no other homes to go to, they would end up in YPU. So I hope this situation has changed, because these children definitely do not deserve to be in they're not eligible for YPU. I'm not saying scrap YPU, but I'm saying that there are people that do not need institutionalization or hospitalization of the sort, but community mental health services would do the trick, or rather would serve them extremely well and much better than being hospitalized. But yes, the issue of human resources is real, and we need to have a human resources strategy. We need to have a human resources strategy. Some time ago, some years ago, we used to have a huge gap in nursing. Then there were campaigns each and every year with regards to intake at the university, huge campaigns, billboarding everywhere, with slogans, get into it and making it rather trendy to go into nursing. If this is needed, we need to do it. But first and foremost, we need a human resources strategy, a serious one, not to look for the immediate, but to look on the basis of 3, 5, 10 years time. We need to think forward, but also, and this is a point which Stefania has mentioned, and I was referring to it, but not that I did not mention it by the name, prevention. I believe in prevention, because I'm convinced that if we prevent, we can manage not to have too much people hospitalized, and also that we will not get a strain, stress on community health services. And to prevent would mean that we need not only go from the young age, but we need to go from maternal mental health services. Maternal mental health services, which I would have loved to have Dr. Atil Felice, who is the founder of maternal mental health services. We need to put a focus on these, because if we have expecting mother who has mental health issues, then the child that is being born to her, if we do not address that, undoubtedly that child will be affected, and most probably it would become an intergenerational situation, whereby then the young person at 25 would have more serious issues, more serious difficulties, and probably also challenging behavior. To be honest, I am perplexed with certain cases that we hear, like having a 17-year-old who has passed through all the educational system and ending up in jail because he challenged the situation and maimed a person for life. And I ask myself, but how come this 17-year-old, how come nobody has managed to see that he comes from a broken situation at home, that he has problems himself, and then end up not only affecting himself, probably his family, but also another family and other people. And we need to ask these questions, because we need to get to the root problem. Many a time, mental health There are situations where mental health problems are simply the manifestation of a cause and at the root. And I think this is what we need to do. We need to have further reflection and analysis, but much more preventive approaches to ensure that young people, adults, would not end up needing mental health hospitalization or certain other. Our education system needs to be very much also, how can I say, is-sistema edukattiva tagħna trid tkun ukoll konxja aware tas-sitwazzjoni u rrid ikollna wkoll għalhekk semmejt l-ewwel il-psychosocial teams in our schools. You can't have a psychosocial team of having with 2 social workers, with maybe a school psychologist and a couple of other maybe assistant psychologists for a college population of 5,000. That's really laughing, in our face. I mean, it's a laugh. Not to say it in another way. Okay, it's a laugh. You can't. We need more psychosocial professionals to be on the spot. Let me give you one experience from the Malta Trust Foundation. So going back like 6 years ago, we started counseling services in the school of at the primary school, St. Paul's Bay Primary School. We identified that school from an evidence-based due to the multicultural environment, etc., to support. Obviously, this work has been going on in perfect collaboration with the school itself, with the college, etc. Then we were asked also to open up counseling services at the Nasharp Middle School, and this year also we were asked to open these counseling services in the Aura School. So during the first lockdown, pre-COVID, we used to support about 400 students. Then during the lockdown, because of our counselors could not go to the schools, obviously, and they were reaching out through telephone. So from 400 students, seeing 400 students regularly, not a one-off counseling session, but regularly, we supported about 1,500 families. So we tried at least to build this sort of support to build resilience, to help build resilience in the families in this area. So I do believe in community services. I do believe that our education system also needs to be in line with what needs to be done so that we can really prevent. And maternal health services to me are very, very important because there we can deduct and we can, yes, help prevent challenging behavior and certain situations later on in life.
Thank you. Dr.
Can I make a point? Can I answer? So two things. One, to follow on, I think infant mental health is extremely important. Okay, and it is much easier to build resilient children than to fix broken adults. And I know that politically it doesn't make sense to have a 20, 30-year plan, and we're thinking 5 years, but the children of today will be the adults in prison tomorrow if we do nothing about it. Your investment in education is extremely important. We're trying We're trying to liaise with education. Thank you. We're trying to liaise with education because we need to work together between interministerially. Okay, there is definitely a need to work with education. We are trying to introduce as a mental health literacy curriculum, which we're trying to introduce, which we brought Senator Kucha from Canada 2 years ago. We had taught, we did this training with 30 teachers through a Department of Education. We want to roll this out, train the trainers, so we can teach the teachers, and teachers will introduce mental health literacy in all curriculum for all years, but also to work with education. So that is answering one bit. YPU, to answer YPU, I mean, I commended the team. I think we're moving away from accepting young people with challenging behaviors or just behavior problems there, because it's unfair to be dumped in the YPU. There has been a movement or an assertive outreach team which is doing fantastic work within the community. So young people who are admitted are followed up within the community, and we aim to prevent relapse prevention. So there is work which is happening there, and we also have a crisis intervention team for 0 to 18-year-olds called CAPES, which is offered by the YPU. So there are changes. To answer the very first question of Neil is, yes, wards have been closed. Management, I think, are trying their best to cope with the crisis with the limited resources they have. But wards have to close. Long-term care patients have been moved out of Mount Carmel, I am sure, to much better environments, because the environment of Mount Carmel is not appropriate. I think we need to accept that Mount Carmel is not fit for purpose. And on behalf of MAP, we strongly advocate that, yes, we need more outreach services, more community services, which would prevent admissions to a hospital. However, we are desperate as professionals and as service users. We need an interim hospital which is on par with physical health. And I don't think we can be more clear. I would be comfortable to be admitted to Mater Dei. I am not sure I would feel comfortable if I were admitted to Mount Carmel, and I can't be more honest than that.
Can I come in, please? Well, I'm going to answer 3, 4, 5, 6, 7 because we all know the question. So bear with me for a few minutes, and then I'll be quiet.
Mario, because we're soon going to run out of time.
Okay. What I wanted to say, I'll try to be brief. First of all, let's face it, psychiatric care has long been termed a Cinderella service. It is much politically attractive for politicians to speak about robots which aid in surgery in Mater Dei hospital operating theaters than opening a new mental service in a locality. The current service, mental health service, leaves much to be desired. And I am really worried about people who cannot go and see a psychologist or a psychiatrist privately. I know we have a problem with these people. I think we need to reduce stigma. Because as Dr. Camilleri said, one thing, when I was parliamentary secretary in charge of mental health, one thing which struck me, and probably it was the reason why I went out publicly, because incidentally, my first bout of depression was when I was parliamentary secretary in charge even of mental health. One thing which struck me, and that's why I started opening services in the community. One thing which struck me is what Nigel said. If I am admitted in Mater Dei, I don't have a problem admitting it and probably take a selfie of myself and say that I am in Mater Dei. But being admitted in a small island like Malta to Mount Carmel, even once, even for a few days, you can lose your job, you can lose a promotion, and relationships are destroyed because that person was in Mount Carmel for a few days. We need also to address stigma, which still engulfs mental health. As a person with mental health condition, I myself know the blow of stigma. It hurts, and it hurts a lot, and occasionally it comes from people and quarters who should know better. I think over the past years, we were given an overdose of labeling. Crazy, Francune, Rotani, Samginen, Fu, etc., etc. As a mental health patient, I would say perhaps we can do without compassion. But thank you, but no, thank you when it comes to labels. Please keep your labels to yourself, I would say. And society had given us an overdose of labels. There is nothing to be ashamed. Mental illness, being mentally ill is nothing to be ashamed of. It is stigma which should shame us all. Regarding Mount Carmel, we're talking about a building which is nearly 300 years old. Both government invested in trying to refurbish it, but at the end of the day, you're talking about the building which is 200 years old, which needs...
Mario, nista' nidħolna mill-intervent 2 seconds fuq dik li qed tajt inti. Nista' ngħid ħaġa?
Please.
Mela, in the last century, we have had actually 3 centuries, we have had 1 mental health hospital. In the last century in Malta, we have had 3 physical health hospitals. Floriana, St. Luke's, Mater Dei. I think you have an idea of the direction.
It says it all, yes. Jina, naqbel totalment illi għanna bżon. Kienem jindem ħambat fil-parlament illi tista taqbad sptar, tibneħ fejtri, tamlu state of the art, ikun izbaħ minn Mater Dei. Issemmiħ li trid, imma xorta se jkun stigmatized. Għaliex Frankone minn fejn ġej, kien hemm Casa Francone, il-Floriana fejn kienu jżommu n-nies bi problemi ta' saħħa mentali u nies qalaw ilhom Frankuni. Jiġifieri tista' tagħmel St. Philip taqbad St. Philip nsemmi sptar li vojt u tagħmlu mental health hospital. Xorta jkun stigmatized li għandna bżonn sptar fil-footprint ta' Mater Dei, illi jiġi connected ma' Mater Dei, physical connection, turwetan ma nafx kif. Ħalli nissi jgħidu jien tħalt Mater Dei, ma jgħidux jiena tħalt fi sptar psikjatriku, irrid ngħid ħadd ma jieħu għalih fuq l-infamuża Worten. Mela Worten għal min ma jafx kienet magħluqa, ilha 14 sena magħluqa. Worten għandek gabuba, litteralment, kamra żgħira, għandek sodda metres mal-art, għandek toqba mal-art fejn tagħmel toilet, jiflaxxjawlek minn barra, ġifieri jekk ma jisimgħux tajjat biex jiflaxxjawlek inti toqgħod mal-koko jew mal-pipi tiegħek għal sija nofsija sakemm jisimak xi ħadd u mbagħad għandek tieqa żgħira bil-gradilija u tal-ħadid. Sewwa dik 14 sena ilu ingħalet. Jiena ma nagħtix tort minn fetaħa għaliex meta nfetħet l-psikjatrija kellha l-ġerni tagħha u mxiet il quddiem. Illum jekk iżżomm kelb f'waħda minn dawn il-gabubi f'Worten jiġu l-animal welfare u jtallawk il-qorti. Għalfejn raġa' tinfetħet din. Qed jużawha ċemptitlihom tifla b'autiżm għax kellha l-Covid żamma huwa imsakkra hemm. 14 sena ilu ingħalqet for a reason. It should be closed once and forever. Għaliex assolutament ma tagħmilx ċans. Jiena ma nagħtix tort il-Ministru at the end of the day għax il-Ministru għandu n-nies tiegħu u jrid joqgħod fuq in-nies tiegħu, ġifieri m'iniex inkun politiku. Din hija l-word għal min ma jafx hija l-word fejn ħadem minnu tal-età tiegħi naħseb sajru sadu iżgħar minni żgur. Ma nafx Mari Louise tiftakkarix, sorry Mari Louise ħatlek biswek eċċellent.
Isma' jiena dak hu ismi ieħor kont se ngħid insomma, ngħidlu laqam jien kultant.
Isma' ma nafx tiftakkar mhux Midnight Express. Il-film Midnight Express. Partijiet minnu dan kien idur madwar ħabs brutali t-Turkija. U partijiet minnu inħadmu fil-Worten. Għax Worten, id-direttur ta' dak iż-żmien, ħasibha illi din hija idonja bħala ħabs brutali u nħadmet ġal Worten.
Mario, 7 years ago jiena mort nara tifla ta' 15 sena hemmhekk.
It's not
Naf eżatt u dħalt ġod kamra idea fuq saqqu mal-art, dit-toqba mal-art, ġifieri u dit-tifla qatt ma kienet qed toħroġ imqarra l-biċċa mixja. U qasriduni nidħol ma tmux taqbad it-tin u dit-tifla poġġejna bil-qiegħda fuq fuq bank ġol-futur għax trid noħroġha minn hemm. U għadna nitkellmu, ġifieri mhux qed ngħidlek dan. Ma affarijiet li ma jitfhmnux fid-dinja tagħna u fid-dinja ġifieri 7 snin ilu mhux qed ngħidlu 200 sena ilu li forsi ma kienx hemm dal-arfien, ma kienx hawn dan knowledge kollu, ma kienx hawn forsi bil-wisq ħafna anqas affarijiet millum. Ġifieri jiena naqbel miegħek 100%, ġifieri dawn mhumiex postijiet fejn żammu n-nies. U kif il-kelba tiegħi bħalissa qed tipparteċipa miegħi tnewwaħ wara. Qed tifhem u dax kemm qed niddeqs magħha smajtuha.
Daħħalha miskejna.
Le, ħdejja qiegħda ma tkun trid tiċċaqlaq minn kamra l-oħra għandi l-bib magħluq. Ġifieri inti għamil dal-paragun, ekku, ġifieri aħna għandna l-liġi tal-animal welfare. Imma mbagħad għandna daw is-sitwazzjonijiet li mhux għandhom iġaluna nistħu, għandna qasbis qatt noħolmu li jistgħu jiġu ġo pajjiżna.
Ekku, issa l-aħħar ħaġa li rat ngħid ma nafx u nixtieq bil-permezz tani forsi tidħol ftit Nigel hawnhekk. Aħna kellna il-Crisis Intervention Team illi kien ta' suċċess, kien jaħdem ma' l-attempted suicide. Kien jaħdem mis-7 ta' filgħodu fl-7 ta' flaxija, kien Multi Professional Team, kena psychiatric nurses, dan għalaq fit-2013. Inna ngħidu u l-laqdiet u anke l-mapna fli qalet biex jerġa' jiffetaħ ma nafx għalfejn għadu magħluq. It saved a lot of lives. Unfortunately, you can only count the number of suicides. You cannot count the number of lives you save. Jgħidu every graveyard, every psychiatrist has his own graveyard. But you don't know how many people you saved, Nigel. You only know how many people you lost. But you saved a lot of people. But you cannot count them. U li fuq diret ndaħlek, Nigel, fuq dal-punt. Jiena kont irrid ngħid għax minn hemm ġej. Irrid ngħid li dal-Crisis Intervention Team illi għamlu l-ispeċjalisti Maltin għax għandna nitkellmu ħafna bir-rispett kollu lej Cyrus il-ħabib tiegħi li qiegħed fl-Unjoni fil-MP. Għandna nitkellmu ħafna fuq esperti minn barra. Dal-Crisis Intervention Team kien sar minn esperti Maltin u l-Belġjani meta dnilhom bih. Tant impressjonaw ruhom illi ġew jaraw għaw Malta kont preżentin biex jibnu jagħmlu għed bħalu fuq modelli ma rrid indaħħal il-Cyrus u jiena rajt xi ħadd sorry rrid indaħħal il-Nigel u ma nafx hekk Cyrus għandu opinjoni wkoll fuqha forsi ra meta kemm ilu Brussels. Jiena l-Belġium rajt sptar. Li huwa sptar psikjatru ġenerali, walk in, walk out, jilqa l-iktar pazjenti perikolużi, m'għandux gates tal-ħadid, jien għamilt minn kollox meta kont segretarju parlamentari biex inneħħi dik l-imbirek gate. Dik l-imbirek gate isek diel laqas kordin m'għandhom dik il-gate. Aħseb wara l-fejn Mount Carmel. It was walk in, walk out. Sewa, kellhom is-single wards kienu attrezzati, in-nersi għad barra jagħmel jara kollox bis-CCTV għal pazjenti li huma danger to self and others, u kien walk in, walk out. Kellhom il-pet therapy wkoll sewa minn somewhat. Nista' jkollna sptar hekk hawn Malta għaliex dak il-gates. Dik il-gate hija parti mill-istigma. Jien għamilt minn kollox, dik il-gate saret għal min ma jafx. Bordni ta' maġistrat għax darba tilqet pazjenta u marret taqbes mill-bridġ tal-Mosta. U l-maġistrat li probabbli ma kien jifhem xejn bir-rispett kollu li l-ġudikatura fuq mental health iddeċida li għandna nagħmlu gejt tal-ħadid. Għallina sekk għaluli l-istorja u saret il-gejt tal-ħadid. U fi żmien kanna każ ieħor ta' xi ħadd li ħarab u għamel suċidju u l-maġistrat qal biex nżidu iktar is-sigurtà u nagħlqu iktar. Ma jafux dawn illi min irid jagħmel saru suċidji ġal Mount Carmel stess. Whatever you do, some people unfortunately will commit suicide. U jien dik il-gate veru d-dajaqni nistaw, Dr. Nigel Camilleri, u Nigel, jista' jkollna sprar id-ħolma tiegħi, qed noħlom jien illi kien walk in, walk out minn għadda l-Madoffa ħadid u virek tal-ħadid illi laqqas fil-ħabs ma stipala. Grazzi.
Biex nirrispondi, it's a very good point, għax l-isptar li kon naħdem fih l-Ingilterra kombinazzjoni kien fuq estate, ġu kelli ħbib tal-familja li kienu jgħixu fuq l-estate, għax da ovvjament kienu asylums antiki, kollha bħal ta' Malta, x'Malta mibnija l-Ingliżi, u kellhom il-villa tagħhom fuq l-estate maġa ta' Mount Carmel li jgħixu hemm. U jien kont ġieli mmur hemm, u mbagħad nibqa' sejjer għax-xogħol. U tmur għax-xogħol ma tindunax li tħall ġo ward għax dawa parti minn estate kbir u kont tidħol ġal adult ward. U għandak adult ward ta' 30 persuna, it wasn't too small. L-unika ħaġa li nsemmu il-forensic wards kienu il-gradi. Ma nagħmlux blanket statement.
Naqbel miegħek. Le, naqbel miegħek. Forensic ward
challenging behavior fit-tfal, fejn violent behavior fl-adulti. Il-forensic wards kienu
Naqbel miegħek.
u kienu isom ħabs. Okay? Imma mental health hospital bil-kem tinduna l-ħagġa, it was nice. It was a very nice, and I mean, I have pictures, very beautiful place, beautiful landmark, expensive estate. Ġul villa li kien hemm, they were expensive, and it was in the town. That is the difference. Mount Carmel is on the edge of a town, on the edge of a town that was built. Imma, in practice, we need emergency services, mux għanna t-tobba bis mater day 24 hours. We need a crisis team. Jem sindu ma najdu. We need outreach teams. And if we don't have these, we're going to have to resort to inpatient work. The more we have in the community, the more we have. Għanna l-budget Malta huwa ħafna fuq inpatient. Il-flus imorru għall-inpatients. Meta l-Ingilterra il-budget 97% jibbefa fuq community u 3% inpatient, il-sodot bed occupancy is very low. It's a good community team. U kif attenti, it's important. If people want to commit suicide, they will commit suicide. We can work with them, but there is a limit. And unfortunately, although the aim should be 0 suicides, we haven't got there yet. So if someone decides to do it, it is impossible. And you can put all the gates in the world. It's just that
Sorry to interrupt. Cyrus, you were going to interrupt.
Nista' ngħid nofs sekonda din. Il-problema tagħna li aħna anke fuq community level nittrattaw il-pazjenti jew inkella s-sufferers ta' mental health differenti kompletament. Jien ma nafx, naħseb kelli 5 esperjenzi f'ħajti li ċemplu li familjari li jkollhom il-xi ħadd li għandu diffikultajiet ta' saħħa mentali ma jkunux jafu jippruvaw iċemplu l-isptar jgħidulhom jew it-tabib jew inkella ħajtu l-pulizija. Ġifieri anke dispett u daw ħafna drabi jiġru fil-festi u fil-weekends għax għalhekk jinqalgħu ħafna ċirkustanzi, immaġinaw u rajthom bajnejja jmorru l-pulizija għall-pazjent. Jiġifieri aħna din jekk jiena ħanajtek jekk jiena nikser sieqi, sewwa ma jiġix il-pulizija joħodni l-isptar, jiġi l-ambulanza toħodni l-isptar, jiġri b'telefonata ssir din. Ġifieri anke hemmhekk inkomplu nistigmatizzaw l-affarijiet.
Thank you. Cyrus, sorry, my next question is at you.
All right.
No, as in, do you have an intervention to
No, I was going to do a small intervention on this and conclude from my end because I have a television intervention in 10 minutes, but you can ask the question and I'll unite everything together.
I will speed read it now. The European Parliament has adopted a resolution on the 10th of July of 2020 on the EU's public health strategy post-Covid-19, which recognizes mental health as a fundamental human right and puts forth the call for the implementation of an EU action plan on mental health 2021 to 2027, whilst also underlining the long-term health effects of COVID-19 in relation to mental health. In your opinion, is there a need for a European mental health strategy, or should this issue be tackled at a national level? In going forward with the implementation of a European mental health strategy, what should be focused in this strategy? So what should it prioritize if it is needed? This will be the final question. So if you have any concluding comments or appeals, go ahead. Thank you. Cyrus?
So I'll apologize in advance because I'll have to leave just after this intervention because, as I said, I have to be on television in 10 minutes. So basically, what you are mentioning now is part of that effort that we had made as an alliance to have the strategy on mental health as part of the European health strategy for the COVID times and post-COVID, looking forward. So we had started this as an idea, speaking in the corridors in the European Parliament, and we have managed to have it in the resolution, black on white, where the European Parliament is calling for this strategy to be part of the European Health Union and the European strategy beyond COVID-19, which obviously is important. We have seen with regards to health in general now, not mental health specifically, we have seen a new way of doing things at a European level. For many years, health has not been part of the competence of the European Union. For many years, since the European Union has existed, health was a competence of the member states. With the pandemic, we have seen a shift when it comes to cooperation between member states. I believe that being united together as member states, we can be stronger. We have seen this when it came to the procurement of vaccines for the whole of the European Union. It was essential for small countries like Malta to have the European Union work together in order to be able to get the vaccines. And I think that we need to do this with regards to medicinals, especially because we need to have accessible and affordable medicinals for all. And this can be achieved through such cooperation between member states. That said, away from that, yes, a European mental health strategy is important, where we have to work together with the rest of the member states in order to define our future. In the past, there were many nationalistic maybe tendencies and many strong views. I think that working together even on mental health will only result in benefits for patients and for everyone who would be undergoing some mental health issues. If I may, to conclude, something that I wanted to stress before, and Her Excellency and even Mario, the Honourable Member of Parliament, they mentioned a lot of titles. They mentioned word 10, and Her Excellency said that when she visited this particular young person, this person was confined to a very small space. What I'm going to say now has nothing to do with that, but it reminded me of one thing that I have been working on in the European Parliament, and which I believe is very important for our country, particularly at this moment in time. People must have access to nature. People, human beings, must have access to a good environment, to a healthy environment. And we are living in a country which, thank God, is doing very well economically during the past years. Obviously, COVID has had an impact, but we are a country that is very strong economically. But we have to be sure not to forget the environmental and nature aspect of our country. Having no access to nature leads people to have an increase in mental health problems. We live in a highly urbanized society. It has its good things to live in a highly urbanized place, country, cities, but we must make sure that we have access to nature. Access to nature is imperative, especially, and I think this has come out even stronger during this COVID period. I see a difference between what happens here today. I'm in Belgium, next week I'll be in Malta, and what happens here and what happens in Malta. Over here, there is that escape from the house and an escape from a highly urbanized area, which is the city center. I can go out, even walk out to parks, to natural places, forests. There's the coast as well, which is not too far away, but there are multitude of places where one can go and be cut off from our highly urbanized and hectic daily lives. So I think my appeal would be for all of us to consider this as being as important as our pockets, because nature and the environment are as important as our pockets and will lead to a better state of mental health for all of us if we can cut off from our daily hectic routines. I'm very sorry that I have to leave, but as I mentioned, I in 5 minutes I have another connection that I have to make. But thank you very much for organizing this. Thank you for all the speakers today. It was very interesting listening to experts. I myself am not an expert, but with the little with this how can I say this, with this avenue that I have been given to be a voice to a number of people, I'll try to do this as in the best way as possible, especially on this important topic of mental health. Thank you very much.
Thank you for your time. Ms. Demexant, would you like to go ahead, or Marie-Louise?
Yes, well, I would like to add some things also to finalize my contribution to this. I think this is great news from the European Union, as Cyrus well have aptly said. This is history, because yes, health has always been considered as something to do with member states and not on a European level. And I think this would, the fact that there is this call for proper action plans from national governments, that would give an impetus also to act. Let's hope for that. But also on a European level, this will help also to hopefully to harmonize services and also speak a common language on this. Like, for example, disability has been one of these areas where there now is a common language. There is this trust into the subject. Well, for me, and I will end with this. It is very important that we invest in mental health as much as we invest in the rest of the health sector. This is the crux of it all. And let's get united to support that mental health strategy, to implement it, and to ensure that we address all the gaps. And let's not forget GOZO in particular, because the gaps there are much bigger than in MUTA. And well done, KSU.
Thank you. Mario, you need to unmute, I think, though. Okay.
To conclude, I'm going to be very, very short. It takes. I don't want to spoil the show, but it takes an expert or two to write a strategy and a minister to launch it. And we politicians from both sides of the house and across the world are passionate and deeply in love with strategies. It gives us a very good PR opportunity. But most of the time, strategies end up collecting dust in office furniture, from my experience. As you know, EU does not have a common health policy, and it's up to the member states to map out, advocate, and implement their own policies. European mental health strategies, I totally agree with it, because at least it's putting mental health high up on the agenda, but European mental health strategies do not change people's lives. It is their implementation which improves the life of people with mental health policies. So I would be all for strategies, but it has to be implemented. One final note, and I conclude with this. I think most of you know the feeling when you are lost in papers. Well, I don't want to keep you waiting, but one final note is practically it is practically one final departing note. We are indeed going through a very difficult patch due to the devastating effects of COVID-19. Additionally, the World Health Organization was already forewarning us, as I've said before the start of the pandemic, that we were going to face a mental health pandemic. The world was going to face a mental health pandemic. We are now in it. I kindly urge everybody who are, I mean, not you, the panel, because I know that you're doing this, but I urge those who are following us to look after each other and be vigilant towards your loved ones. Remember, and I will conclude with this, remember that sometimes the loudest cries for help are the most silent ones. Thank you very much all, and it has been a pleasure to be joined by such distinguished, proficient, knowledgeable people. I learned a lot from this seminar. Thank you a lot.
Thank you, Maria. Ms. Demexant?
Well, having a European strategy would help us to, well, a push from above always helps. So if we have a common understanding of what we should be aiming for, that is definitely a bonus. However, as Mario rightly pointed out, like so many other things, what we actually need is the political will to actually get things moving. If that is there, we will find a way to sort things out. It will not be easy, but if we all work together from above and below, we will find a way how to make things work. Just to end on a hopeful note, Richmond has been very aware of the gaps which are out there in terms of services for young people, and is currently working on 2 projects addressing young people. One will be launched in a couple of weeks, and another one hopefully towards the end of the year, both about support and about education, which we referred to earlier, for all those involved in supporting young people with mental health issues.
Thank you, Mr. Demexant. Dr. Camilleri?
Thanks. I won't take up too much of your time. Thank you for this. Thank you for those who are pushing for a mental health strategy. I think, yes, strategies are good PR, but as was mentioned, there needs to be an action plan and a Gantt chart of how it's going to happen. I think that is extremely important. And I think the key message is we have a mental health crisis. So let us all talk about mental health and not be afraid to talk about it. Let us put mental health on par with physical health. Until that happens, we're not going to improve. Okay. I think the voice of the service user is extremely important. And so far, I have not seen this in Malta. The service user needs to be included on the board, on every discussion board, possibly even today. Because if we're going to develop a hospital, then for adolescents, it's good to have an adolescent's perspective of what they want to see in it. Not I assume that they want a picture with Mickey Mouse and then they tell me Mickey Mouse is not cool because they will not like the place and they will not respect it. That's a very minor detail. So the voice of the service user on every level of the panel. And I think I would like to end by thanking all people working in mental health services, colleagues, because we are very low on the ground, small in numbers, but I think we're passionate and we're trying. But there needs to be a push. Let us increase staffing and improve training quality.
Nili, jek tippermettili se nikser ir-regoli. L-iktar nies, l-inqas nies li jieħdu prositu grazzi huma n-nies li jaħdmu fil-qasam tas-saħħa mentali. Jiena rajt mirakli jsiru meta kont segretarju parlamentari u rrid nieħu l-opportunità li nirringrazzja Nigel lil kollegi tiegħu psikjatra, psikologu, nurses lil daw kollha li jaħdmu fil-Mount Carmel għax daw ħafna drabi qatt ma jissemmew. Daw they are our silent heroes, qatt ma jissemmew. U rrid ngħidilhom grazzi mill-qalb.
Grazzi lil kulħadd, grazzi lil min segwa, u nistgħu nagħlqu hawnhekk. Grazzi ħafna u l-lejl tajjeb.